How do cancer cells get to the lungs? Can lung metastasis produce blood-stained cough? Why is it difficult for people with lung metastasis to breathe? Can we die as a result of the metastases that invade the lungs? The answers to these questions and many more in this video. Watch it, and lung metastasis will no longer be a mystery. Pulmonary metastases are clusters of cancer cells that come together to live within the lungs. They grow progressively, forming larger and larger masses. These cancer cells can come from anywhere in the body. They arrive to the lung through the blood. In the organ where the original cancer appears, the cells of this tumor break the wall of a blood vessel and travel throughout the body, looking for a place where they like to live. The lung is usually a very frequent destination because within it the blood vessels become very small. This way they accomplish their function of oxygenating blood. When a vessel becomes very small, the blood circulates more slowly in it, and that is why it is easy for the tumor cells that are swimming in the blood to leave the vessel, coming out of it through some of its pores. Living in the lung will allow the cells of the metastasis to be well oxygenated and have access to the food that reaches them through the blood, since the lung has a lot of blood supply, an ideal situation for them. Not all cancer cells that reach the lung will eventually build a lung metastasis. In fact, most of these cells, at least initially, will die when they are attacked by the defensive elements of the lung itself, which recognize them as strange cells. But there comes a time when the lung defenses are overcome, because many cells are coming, and many begin to escape and survive the attack. When these cells that have avoided the defenses get into the flesh of the lung, they begin to grow out of control, which will form masses of millimeters in size, which will continue developing till they reach centimeters. This growing lung metastasis will push the cells of the normal lung around them, that is, the lung tissue that is working on the oxygenation of the blood, or the blood vessels of the lung itself, producing the symptoms that we are about to see next. We cough when something is irritating our bronchi, which are the tubes through which the air reaches the area where the blood oxygenates. If we breathe in a large particle by stimulating the cough reflex, it gets thrown back out of the lung into the atmosphere, preventing it from accumulating in the lungs. But in lung metastasis, the elements that trigger the cough reflex by irritating the wall of the bronchi do not come from the outside of the body. They come from within. The heap of cells that is growing inside the lung touches the bronchial wall and causes us to cough. But as we cannot expel anything because that metastasis has come from within, we will continue coughing more and more. We will cough during the day, and we will cough at night, because the tumor doesn't understand early rhythms and will be irritating the bronchus all the time. Groups of tumor cells growing inside the lungs might come in contact with one of the thousands of small blood vessels that contain these organs. When this happens, at first the blood vessel is simply pushed, but when the pressure of metastasis continues, the blood vessel will break. Where does this blood go? It goes to the air space of the lung, where the air, whose work is to oxygenate the blood, enters and exits. This blood is very irritating to the wall of the bronchi. Each time bronchi feel this blood, they will trigger the cough reflex. This cough, coming out stained with blood, will be very striking. This phenomenon is called hemoptysis. It is not very often that they do, but yes, pulmonary metastases can produce hiccups. For that, they have to be located in the lower part of both lungs, the one that contacts the muscle that separates the thoracic cavity from the abdominal cavity. This muscle is called the diaphragm, and its work is imperative for us to be able to breathe. When this muscle is tickled, which is very simply what can happen when a lung metastasis grows in the lower part of the lung, the diaphragm loses the respiratory rate. He becomes a little crazy and contracts when he does not have to. This arrhythmic contraction is perceived as a hiccups attack. The problem that our hiccups is triggered by a lung metastasis is serious. It will be a very difficult problem to solve unless you treat the metastasis. Grandmother remedies of covering the nose, drinking backwards, or giving somebody a good scare will not work. The lung needs to move inside the chest, and for that it must be covered by a membrane surrounded by water to avoid rubbing with the ribs. This membrane is the pleura. The pleura has two parts. The one that is attached to the lung, or visceral pleura, which is responsible for producing fluid that allows frictionless movement of the lung. The one that is attached inside the ribs, or parietal pleura, that absorbs that liquid so that there is not too much, preventing the lung from swelling. When lung cancer reaches the visceral pleura, it becomes inflamed. Because of this inflammation, it begins to produce more fluid, and there comes a time when the parietal pleura is not going to be able to absorb it. Fluid will start to accumulate. This is called pleural effusion. If this spill is very large, it can prevent the lung from swelling, which will cause a sensation of difficulty in breathing, which is called dyspnea. The irritation of the visceral pleura through the lung produces a very annoying cough. And if the cancer reaches the inside of the ribs, upholstered by the parietal pleura, it can pierce them, producing pain when breathing. Unfortunately, yes. Pulmonary metastases can be the direct cause of the death of the person who suffers them, in two ways. The first, when they are very abundant. If there are many metastases and they are very bulky, the amount of healthy lung that is left to the patient is becoming smaller and smaller. And that's why the person can breathe less. The blood does not oxygenate properly, and suffocation causes death. The second is very striking and needs less amount of tumor in the lungs. It occurs when a metastasis is placed next to one of the great vessels of the thorax, especially near the vena cava and its entrance into the lung, or pulmonary veins, because the arteries have thicker walls. If the tumor mass infiltrates one of the great vessels of the thorax and breaks its wall, an internal hemorrhage will take place that will fill the lungs with blood, drowning the person suffering from this metastasis. If blood, instead of accumulating in the lungs, leaves the bronchi to the nose and mouth, you can see how the person starts vomiting blood. In a few minutes, he bleeds and dies. Symptoms that can occur from lung metastasis from a cancer that has developed elsewhere in the body are cough, hemoptysis, difficulty breathing, a symptom called dyspnea, hiccups, pleural effusion, pain in the ribs, massive bleeding and death, and drowning and death.